Do you know what high blood pressure is and why it's a serious health concern? It's a health risk often linked to heart attacks, heart failure, stroke, and kidney disease. Despite being asymptomatic, it poses serious concerns. When your doctor tells you your blood pressure, they cite two figures, such as 130/80. The top number represents the arterial pressure during heart contraction, while the bottom number indicates the pressure when the heart is at rest. You might have heard the term elevated blood pressure. This is a cautionary phrase for levels that are not yet classified as high, but are not ideal for good health either. Now, let's talk about the classifications of blood pressure. We have three main categories. The first is high blood pressure, where the top number is 130 or above, and/or the bottom number is 80 or above. The second is elevated blood pressure, where the top number is between 120 and 129, and the bottom number is 79 or below. Lastly, we have normal blood pressure, where the top number is 119 or below, and the bottom number is also 79 or below. Understanding these numbers is crucial. They are not just figures but tell a story about your health. They provide insight into how hard your heart is working and how your arteries are handling the pressure. And remember, high blood pressure often comes without symptoms. It's a silent threat, which means regular checkups are vital. This is just the beginning. We will delve deeper into the risk factors, treatments, and other necessary information about high blood pressure in the following sections. But for now, remember this. Understanding these numbers is the first step in managing your health. Ever wondered what makes you more susceptible to high blood pressure? There are numerous factors that come into play, some of which we can control and others we can't. Let's dive into these risk factors to better understand them. First, the uncontrollable factors. Age plays a significant role. As we grow older, the likelihood of developing high blood pressure increases. Family health history is another crucial factor. If one or both of your parents experienced high blood pressure, your risk is naturally higher. Race also factors in, with Black individuals facing a higher risk, often due to non-medical factors like limited healthcare access and food choices. Certain health problems like chronic kidney disease can also increase the risk. Finally, some medications may inadvertently raise your susceptibility to high blood pressure. Now let's pivot to the risk factors we can control. Weight is a big one. Maintaining a healthy body weight can significantly reduce the chance of high blood pressure. Diet is another key factor. Opting for a diet rich in fruits, vegetables, and low-fat dairy, while limiting meats, sweets, and refined grains, can go a long way in managing your risk. Sodium intake is also important. The less sodium you consume, the lower your risk. On the flip side, ensuring you have adequate potassium in your diet can decrease the likelihood of high blood pressure. Physical activity is another controllable factor. Engaging in 30 minutes of daily activity, be it walking, dancing, or whatever you enjoy, can help mitigate risk. Lastly, alcohol intake. Reducing alcohol consumption, defined as 14 or more standard drinks per week for males and 7 or more for females, can lower your risk. So as you can see, while some factors are beyond our control, there are many ways we can actively reduce our risk. With a little attention to our lifestyle choices, we can make strides towards preventing high blood pressure and promoting overall health. If you have high blood pressure, it's not all doom and gloom. There are ways to manage it. Let's dive into how you can keep your blood pressure levels in check. First and foremost, lifestyle changes are paramount. A healthy diet is your first line of defense against high blood pressure. Think of loading your plate with fruits, vegetables, and low-fat dairy. Limiting meats, sweets, and refined grains also helps keep your blood pressure under control. Weight management is another key factor. Maintaining a healthy body weight reduces the chance of high blood pressure. It's not about a number on the scale, but about feeling good in your own skin and reducing health risks. Next, consider your alcohol intake. If you're a fan of the occasional drink, moderation is the name of the game. Reducing alcohol intake to 14 or fewer standard drinks per week for males and 7 or fewer for females may lower the risk of high blood pressure. Physical activity is another essential component of managing high blood pressure. Aim for 30 minutes of daily activity. This doesn't mean you need to run a marathon. Walking, dancing, or even gardening can do the trick. Now, while lifestyle changes are crucial, sometimes they aren't enough. In these cases, medical intervention may be necessary. Depending on your blood pressure levels and existing health issues, your healthcare provider might prescribe medication to help manage your blood pressure. It's important to note that treating high blood pressure isn't a one-size-fits-all approach. What works for one person might not work for another. That's why it's crucial to work closely with your healthcare provider to find the best treatment plan for you. Remember, managing high blood pressure is a team effort between you and your healthcare provider. It's about making small but meaningful changes, monitoring your progress, and adjusting your plan as needed. With commitment and patience, you can take control of your blood pressure and lead a healthier life. What else can you do to improve your health when dealing with high blood pressure? Now, let's delve into some additional measures that go beyond the basics of diet, exercise, and medication. One of these is quitting smoking. While it may not directly lower your blood pressure, it plays a pivotal role in your overall health and significantly reduces the risk of heart attack or stroke. Smoking is like adding fuel to a fire when it comes to heart health. It damages blood vessels, making them narrow and stiff. This puts extra strain on your heart, and when combined with high blood pressure, it amplifies the risk of serious health complications. So if you're a smoker, it's time to seriously consider quitting. It may seem daunting, but remember, it's a step-by-step journey and there's plenty of support available. Your doctor or nurse can provide assistance and connect you with resources to help you quit. Next, we're moving on to another important aspect of managing high blood pressure: home monitoring. While regular checkups with your healthcare provider are essential, home monitoring can provide a more comprehensive picture of your blood pressure levels. It helps you keep track of any fluctuations and can be a valuable tool in managing the condition. These monitors are readily available at pharmacies or online, and they're simple to use. Keep in mind that home monitoring doesn't replace regular visits to your physician, but complements them. It gives you the power to be proactive about your health and enables you to spot potential issues early. Remember, high blood pressure isn't just about the numbers. It's about making holistic lifestyle changes that promote heart health and overall well-being. From quitting smoking to monitoring blood pressure at home, every step you take brings you closer to a healthier, happier life. High blood pressure management extends beyond just numbers. It's about making holistic lifestyle changes. Let's revisit what we've learned about high blood pressure. It's a health concern that often goes unnoticed due to its lack of symptoms, but it's a significant risk factor for heart attacks, heart failure, strokes, and kidney disease. When we talk about blood pressure, we're referring to two numbers: the pressure in our arteries during heart contraction and the pressure when the heart is at rest. We've learned to pay close attention to these numbers as they can indicate whether we're dealing with high, elevated, or normal blood pressure. We've also discovered that there are numerous factors influencing our risk of high blood pressure. Some of these are out of our control, like age, family health history, race, certain health conditions, and specific medications. Yet there are plenty of risk factors we can control, such as our weight, diet, sodium and potassium intake, physical activity, and alcohol consumption. We've found that maintaining a healthy body weight, consuming a balanced diet rich in fruits, vegetables, and low-fat dairy, and engaging in regular physical activity can greatly reduce our risk. In terms of treatment, we've learned that managing high blood pressure often involves making crucial lifestyle changes. This includes maintaining a healthy diet, keeping our weight in check, limiting alcohol, and staying physically active. Medical interventions such as prescribed medications might also be necessary depending on our blood pressure levels and existing health issues. Beyond these basics, we've also learned the importance of quitting smoking for overall health. While it may not directly reduce blood pressure, it significantly lowers the risk of heart attack or stroke, promoting a longer and healthier life. Home blood pressure monitoring may also be recommended in some cases, providing an easy and convenient way to keep track of our blood pressure. Remember, understanding high blood pressure is the first step to managing it effectively. Stay healthy and proactive in your health journey.